So let's just, I just wanted to go over the new funding. Phase 4 opens today. There is $25.5 billion available. Interestingly, 39 of that, I think it is left over from phase 3. So that's included in that money. So there's $8.5 billion of this is for rural providers. The eligibility formula is going to use Medicare and Medicaid claims data. So when you apply for this, they're going to look at your claims data, and they're going to look at your patient population and where they live, and how far they live from healthcare services and whatever. And so they are, they're going to use that data to get that money directly to the providers in those areas. Phase 4, again, is modeled after phase 3. We looked at the forms. They're almost exactly the same as the ones you filled out before. They just have some different dates on them. So there's $17 billion available to apply for. 75% of this money is earmarked for practices that can show lost revenue and high expenses, so losses in general in the practice. In other words, the practice has not recovered after COVID. So that's how they're going to do it. There is an additional bonus payment for medium and small practices. They didn't have the definition of what is a medium and small practice, so they told us that that actually would be coming soon. And then the remaining 25% is going to be dedicated to providers who serve Medicare and Medicaid patients. So if you can't show lost revenue or losses in general, and you don't see a lot of Medicare and Medicaid patients, I'm not sure you're going to get much of this money. But based on the forms, they're not difficult to fill out. I would just go ahead and submit it if you can, because the worst that can happen is you get 0. And I don't think it will be a time-consuming form to fill out. Okay, next slide.